It's in the drug that.
Laura, you there?
That her video may not work. Oh, there we go.
Yes, I'm here.
Okay, perfect. So we got you down for a request.
Yes, thank you for getting me in last moment. Our custodian that we hired last month has resigned. So I need your approval to replace that position as soon as possible since we're in the middle of our very busy season.
So your request says $18 per hour. How many hours per week?
It's set for 15, but I think it's budgeted for 19. And that's what we've been paying the last two prior custodians.
So it's budgeted for 18 hours a week.
15 hours a week at $18 an hour.
Oh, I see. Okay. All right. You have someone that you have in mind, or?
No, we do not. We're going to have to advertise.
Okay.
We had a difficult time finding the last one, so I'm hoping we can get somebody.
Commissioners, questions? That would be just at the Fremont Center.
It's the complete grounds at the fairgrounds. It's the Fremont Center, the Heritage Hall, the Little Wind, the grandstand bathrooms, the bathhouse, all of our facilities at the fairgrounds.
Okay.
Mr. Chairman, and that's a part-time job? And he leave because it was too much?
Yeah, he said it was more than he expected. It was carnival this last week. So it's a little bit more those days. Typically during fair, in the past, they have been allowed to have extra hours during, fair week and fair season. But during non-peak times, there's not been a complaint about being able to get work done in the allotted time. Well, in the past, there hasn't been a complaint about getting work done in the allotted time during fair too. It's just always been a little bit extra, and I have to look back and see how that was handled, but
Questions? Commissioners?
Sure.
Yes.
Motion to approve this request for a custodian part-time, $18 an hour at 15 hours a week for the fair.
Second.
Been moved and seconded to approve request to rehire to fill a position as custodian for the fairgrounds facilities, 15 hours a week at $18 per hour. Further discussion? All those in favor?
Aye.
Opposed? Motion passed.
thank you so much, and thanks for getting me in on short notice.
Okay.
I
thanks,
appreciate
Laura.
it. Thank you.
Jim?
Unless you want printed.
I don't think anybody else can. No, Larry.
Just to bring them all. I haven't bring it with my arm, but I gotta start bringing it. Yeah, bring them up. All right.
There.
So we have the treasurer up twice. Is it gonna go consecutive or are you
No,
gonna wait?
I'll do, my department now, and then we'll do all those other ones towards the end of the day, and if we run out of time, we run out of time.
How is it going?
You're in the dark.
I've used candlelight.
All right, Jim.
So, all right, you guys, are you guys ready?
Yep.
All right, yes, sir, Chairman. So this is just in the budget hearing for my general fund department. Let's see, we'll go to, here we go. All right, so you can see from the budget, and I know you haven't had a chance to look through the budget message. There's a handful of revenues that are reported directly into my department that are generated by my office. Those include a collection fee on sales and use tax, or just on use tax, excuse me. Collection fee for collecting property taxes on behalf of the cities and towns of the county. We have some fees associated with our tax sale and tax liens. Let's see, we do collect NSF check fees, which we do get a fair amount of every year. And also, we collect postage for mailing of plates, as well as temp tags and record search fees, things like that. It's just some miscellaneous things. So the biggest thing, revenues basically are staying about static with the exception of our postage account. In 2025, we were doing a new series plate year, which meant that we were mailing out license plates as opposed to just paper registrations. So we were collecting for everybody that wanted to have it mailed to them, $7 per set of plates was being collected from that. And now that we're just sending out registrations, stickers and paper, we're back down to just a $1 collection for mailing. So overall, the revenues are down $24,100 from the current year to what I'm projecting for next year. And 25,000 of the 24,000 is postage. For the current year, so I had budgeted $191,000 in anticipated revenue. In the current year, I'm anticipating $206,800 coming in. Revenue projections for next year, $166,900. On the expenditure side, you did approve SOC increases for my department last week, and I appreciate that. So overall, without getting too far into the weeds, my adopted budget for fiscal year 26 was $1,078,741. I am projecting it to come in on the expenditure side of things at $1,047,740, which is about $31,000 under budget for the current year. Looking ahead to next year, budget request is $1,127,446. Stop and read instead of, which is $48,705 more than the current year. The bulk of that, all of that really is associated with the SOC adjustments that you just approved. I think overall the personnel cost increased $66,000. So the fact that I'm $48,000 more next year than last year means I'm reducing some things. And not surprisingly, the largest reduction is in postage. So we're not going to be spending as much in postage this year either. So anyway, there's not a lot of new things going on. I guess the one thing I do want to point out is when it comes to the bond that's required for me, the statutes are a little unclear. It seems very very clear for most other elected officials that they're supposed to have $100,000 bond. Mine says that it is the responsibility of the commissioners to set the bond amount. And in lieu of that, they had some sort of astronomical number of, it should be like 1.25% of the tax revenue received. What's not clear to me when reading the statutes is, do they mean county tax revenue or total tax revenue for, so is it just 12 mils of tax or everything that we collect? Because that would put the bonds somewhere between 8 million and $50 million. That would be kind of astronomical. I did check around with other county treasurers to see where they were at. It kind of ranged from 75,000 on the low end up to $250,000 on the high end. Most people were right around the $100,000 mark. From a budget perspective, and this was pretty much a swag based off of some emails that I saw. I assumed that if we were going to go with a $250,000 bond for me, that would put us at about $3,200 or $3,100, I think, for my bond, and then an additional $100 or something like that for my deputy's bond.
Would he be the same amount?
No, it wouldn't be. If it was, we'd be looking at $6,000 or $7,000. I did have an increase as well in printed office supplies. Our bank, if you're not aware, BMO sold all of the branches in Wyoming and a lot of western states to, I believe it was First Citizens Bank or Citizens First Bank or something like that. That transition is supposed to happen in September, like over Labor Day. Because of that, because they're moving from an existing bank to another existing bank, we will have to be changing all of our routing numbers, possibly account numbers. We'll see how that works. But what that means is I'm going to have to, and this will affect not just my office, but Julie's office as well, and anybody that has check stock will have to get new check stock with new bank information on it, new endorsement stamps, all of that sort of stuff. So my printed office supplies is going up a little bit in anticipation of replenishing. We were fortunate enough that we were getting close to the end of the stock that we had. So it's not like we will be throwing a bunch away, but it is going to be an expense to go through and get everything back up with new numbers and new pictures and all that good stuff. Otherwise, everything's kind of status quo.
Okay. So see, you still have some funds remaining from the ARPA.
Yes.
Have you got any leads on training?
Yes, I am attending a training actually in a couple weeks, which isn't great timing from a budget standpoint, but I'll be in Gillette with the grant management office for a 4-day grant management and grant writing training. There's a training opportunity in July for grant writing. And then I was speaking with Julie through the membership that we have with the Association of Public Treasurers of the US and Canada. They offer a lot of classes for cash handling, internal controls. They do offer classes for fraud prevention and customer service, but there are a few of these things that they have workbooks that we could buy and to kind of create our own trainings. And so I was considering getting workbooks for internal controls, which would go out basically to all of our elected officials to make sure that we are doing everything legally and keeping track of our finances in an appropriate way. The cash handling, of course, would be really available to my office, Julie's office, anybody that's handling cash on a regular basis, and even the people that are handling cash on an occasional basis. We could take these workbooks and we could develop our own training and do them internally as opposed to trying to get in touch with them. And then there was another set of workbooks for cash forecasting or cash flow forecasting that I thought would be useful in the treasurer's office to develop that for those of us that work on the revenue side of things. And so I'm looking at buying some of those. There's still a fair chunk of money, and I have kind of offered this to other departments that if there's something that that is useful for other departments, training wise, especially if it relates to the finances of the county or fiscal responsibility. I think I could probably assist with some of that out of ARPA money, because we are on the clock to get that spent.
Questions, commissioners?
Thank you very much.
Thank you, Jim. We're gonna skip over cash, JTC and youth services, so.
So it's all approved.
Just something like that.
Yeah, just like that, only different.
You know, take it.
Yeah. Careful what you wish for. Sorry.
Back there again.
Yeah.
It does not matter to me if you guys have one pulled up already, we can start with that. Or I can just start with cast. Okay. So here for the budget, hearings for cast, JTC and youth services. I do have some SOC requests. Would you like me to start with those before?
Let's do that, yeah, we can do it now.
Okay. So I have one for the cast budget. Currently this individual has completed their hours as a provisional licensed therapist. And so the paperwork is at the state. I'm anticipating within the next 30 days, he will have his full, the actual license in hand. And so I'm requesting a pay increase of $5,210, which goes in between level 2 and 3 on that 50% pay scale that I was provided by Emma.
So this is for the therapist.
Correct.
And it would be a level 3?
It's in between level 2 and 3. Prior, his level was kind of in between level 1 and 2.
Questions, commissioners? How long has this employee been working?
His first tender with us was over a year, and left for a short bit, came back, and I believe he's now been back since November.
Yes.
Is that correct? Yes. Okay.
Sorry to think that. Questions, commissioners?
So, Mr. Chairman,
Yes.
I was looking through your SOC. Just in general overall, well, I'll just start with this process. So I guess 62. And we want to go to 67. So. And they are gonna stay, oh no, they're gonna move to a level 3?
So I don't know if I understood all of this either. Because within the paperwork that Emma, and I don't know that I even brought it. I don't think that I did. My printout was the 10%, 25%, and 50%. And so within, they've been at the 50%. So that's a level 3, I would say, on that aspect. But then within that 50%, there's also those level 1, 2s, and 3s. He currently is in between a 1 and a 2. And I'm asking that it be moved in between the 2 and the 3
At the 50%.
at the 50%.
That's where he was at, starting.
Within the 50%.
So we started.
Because he's a therapist.
I'm saying. Correct.
Sure.
Yes.
It's just like, if we had a nurse or a doctor or therapist, they're gonna start at that certain level, meaning 60,000, 70,000, 80,000, they're gonna be in that range when they first start. Because they have probably a master's degree, they probably have years of experience. Yeah, the therapists, or they have credentials, meaning they have a LAT, or they have a license, or they have a LCSW, or anything in that sense, from the state. So in that, they have those credentials. That's why they're at that level.
Well, I'm struggling a little bit because, you know, if I look at some of the others, they're at the 25%. And I don't follow the logic that says that because they have a degree, they start at 50%. Why wouldn't their scale be up there to begin with? Because they've got those degrees.
Because
That doesn't make sense.
because that's how this developed.
Mr. Chairman, I don't think this particular person had worked here before. I don't believe he was in the 50 percentile to start with.
I believe he left in the 62.5.
Right, but I don't think he started when he started with us. I mean, I think they had him in an area where they thought he should be to begin with. And then he had moved up because of their, their degrees and all that stuff. I think it was allowed for us. There was a big jump at this table.
Okay.
Allowing, I don't know if it was Casey or which one had
Right.
asked for that. There was a big jump to get our therapists and all that stuff up. And then we kind of hit that, don't go past the 50 percentile thought process. But there are some people that didn't get like the $3,000 for everybody. If you recall, if they were above 50%, they didn't get it. So just FYI, those are history things that we did here at this table. So.
Okay. Well, Where do you want to stay with Cass first?
Okay, so that is the only SOC within CAST.
Mr. Schultz, you.
Motion, Chairman, motion approved this, stated SOC, from CAST. And the amount of an annual increase of 57,710 for the position of therapist. Remember it that way.
And so,
Make the motion to approve recommended SOC adjustment.
That was the easiest way to say it, son. Thank you, Chairman. I'm still waking up.
Do I have a second?
Second.
We moved and seconded to approve the recommended SOC adjustment for the cast employee request. Further discussion? All those in favor?
Aye.
Opposed? Motion passed.
Thank you.
Right.
So I'm going to apologize ahead of time if I fumble through this. Um,
Where we,
the,
I'm sorry, Mr. Chairman, we stay on SOCs or really good, but.
whichever you would like me to do, I can
Whatever.
stay with the cast budget.
Okay, finish that. All right.
Okay. So for the 2027 fiscal year, the total revenues within the cast budget is projected to be $391,512. A huge source of that funding is coming from the Wyoming Judicial Branch, for the grant that you guys had signed and approved last week. I had also applied for a $122,000 opioid abatement funding, which I learned last week was also approved. So that has been added in the budget. Some of the fees that we always anticipate on generating is our client fees for the program. Typically, it never reaches that generated amount. This year, we're looking at $14,400. The reason why that never really generates that money to that specific amount is because treatment cannot be a barrier for our clients. And so, money cannot be a barrier for our clients to get treatment. So they can do community service to pay for their fees that are allocated to CAST. A lot of our clients take that opportunity and are out in the community doing community service to pay for those fees. Honestly, some of the biggest expenditures within the CAST budget is going to be our personnel costs. So the salaries and our benefits. There will be some expenses in our case management and treatment, such as our journaling our curriculum, because that is kind of once you go through it, not another participant can utilize that book. We're also spending money in drug testing as we send off for lab confirmations, purchasing the actual cups to begin with, and then our contractual services. So that is some of our expenditures that are typical and don't really ever change unless it's on a dollar amount basis. Some of the budget changes from last year is the contractual services, as we did contract with specialty counseling out of Cheyenne. And so they have a $3,000 contracted service every month to provide that clinical supervision for the agency. We also have a defense attorney that we pay on a contractual basis. Another.
So
Yep.
would that, would your legal counsel be under a contractual?
Yes.
Thank you.
Another line item that I would like to point out is that there is a 12-month allocation for unemployment due to some staffing changes. I don't know if it's going to be utilized for that 12 months, but I wanted to put it in to make sure that it was budgeted appropriately for that unemployment claim that we have out. Everything else within the budget that I could foresee changing based on some historical data or have kind of become creative in meeting the needs of our budget. I have looked at reducing those prices because I do know that contractual service took a pretty big jump.
The revenues took a pretty good jump too.
Correct. We were granted quite a bit more money from the judicial branch this year, so that was extremely beneficial. And then the opioid funding also will help within the budget.
Anything further? Yes.
Excuse me. I see a note here, and I think I know the answer to it. So, on your 24,000 that's listed as if that it wasn't there last year. So that apparently is part of your salary or somebody's salary. It says director salary question mark. Not sure why it's not being allocated in.
So
It
from
has-
2025 then to the 2026, I don't know what that is. I'm assuming it's part of my salary, but I don't know if I'm not coding it correctly when I get it to JP. And so that's something that I have to,
But for next year, you want a third coming out of each one of the budgets?
Yes.
Okay, so let's take a look at that because this can't be put in just in the O and M because it will not figure benefits, and it may not be, but I want to make sure wherever your main place of where your name is in the personnel, is that on here? Are you the coordinator?
no, I believe my main is under the JTC is where I
Okay.
found it.
So I'll just make sure that it's pulling over correctly. Maybe it's fine. I
Okay.
just want to make sure for you, because you had kind of question marks about that. So I just want to make sure on that one. That's all I think I had.
Questions, commissioners? Great. Guess we'll move on.
Okay.
JTC.
The JTC budget for 2027 went the other direction, from CAS as it decreased significantly compared to the 2026 budget. The Wyoming Judicial Branch did not, fund the program as it had in the past. Currently, there's a difference of $227,000, to work with for this upcoming year.
Mr. Chairman, can you give some explanation of that? What's the thought process coming down from the state?
We weren't getting referrals. I know Commissioner,
The rule change?
Commissioner Thomas and I spoke on, how do we try and navigate referrals? How do we? So 2 years ago, we lost our delayed sentencing bond that was specific to Fremont County that would allow juveniles to have a court order to come into JTC.
Chairman noted that was done by the prior
Right.
prosecutor on his own. Meaning it
Correct.
can be changed.
So,
It can be changed. He did it on his own. Meaning we are an entity. In a sense, other JTCs in other counties are able to process, right?
they struggle as well. And I do know so there's only 2 other juvenile treatment courts in the state of Wyoming. And I've been in communication with both of them, and both of their programs were significantly cut as well. And so it's not just us, unfortunately. So I don't know if that's the answer anybody wants to hear, but
So, Mr. Chairman, so for some time, I've always wondered why there are so few of these. Has that number dropped over the years? Seems like there were a few more, than two of us left, or three of us that have a JTC,
Wyoming as a whole does not have a judicial court.
right?
And that is an issue. By the time individuals are sentenced to a juvenile treatment court, they are beyond our need or our capability of services and often are placed into residential facilities.
Chairman, the state of Wyoming, in all of their understanding, has placed everything in a sense of juvenile justice under the Department of Family Services. The Department of Family Services is only meant for child protection.
Right.
But because of somebody's thought process, other states have what's called a Justice Department. In that Justice Department, they handle both adults and juveniles. So you have a Juvenile Justice Department, which handles the process of juvenile treatment courts, in the sense of juvenile justice, in the sense of what's going to happen with them, even when they're processed through detention, they have detention centers. We just barely in the state of Wyoming have considered detention centers, which one is located in Casper, but it's full. The other one was located down in Rock Springs. In that, state of Wyoming has not ever gone to the point of researching or going back and looking at why there is not an independent juvenile justice department, so that things process easier for people to see the flow. Right now, DFS handles everything in a sense of not just CPS, but juvenile justice, which is not, most judges will tell them, I can't have you in front of me and talk to me about child protection, but at the same time, you're telling me that child's on probation. So you're the probation officer and you're the CPS worker at the same time. That's what's happening. And so in that, we don't get what we need in the sense of what's needed for that juvenile.
Mr. Commissioner. I guess I'm looking at trying to interpret this move that they're making and basically asking, bottom line, we're gonna be asked to pick up the tab.
Yeah.
This is something that the state's not committed to. And I get it, they gotta come up with a better solution and all that, but in the meantime, that's a pretty doggone big hit to our budget. I'm struggling.
Chairman, that's why we've been speaking about how to come up with an alternative means in a sense for JTC. And said and that's what she's been researching, is what can be done.
But the ask is gonna be to our general fund to pick
Yeah.
up the $300,000,
Right.
right?
Not necessarily.
What's this $304,000 transfer from the general?
Well, in the sense that we can, if we can make some changes within our own county, we could end up gaining state funds by their own way of allocating funding by numbers. We just don't have a number. So the lower of youth numbers using JTC, the lower the amount of money she's getting. So, but we used to have a huge amount of budget for JTC. Because numbers were high. And so they were allocating a large amount of money for juvenile treatment. But, that's something her and I have said we need to come to the table. We need to talk about it.
But are they willing to come to the table? Are they just, since there's only three in the state, are they just gonna blow it off and just say, well, if you want it, you pay for it?
Well, and I think to start with, to come to the table, we need to have discussions with the county attorney and see if we can mediate how do we get kids into the JTC services, prior to them having a higher treatment recommendation, so that we can start showing some of those numbers as well.
Mr. Chairman, last time we talked with our county attorney, he seemed to support this movement on the delayed sentencing law. In terms of what the action was before. From his predecessor, he seemed like, I didn't get the flavor that he was saying, yeah, we could take this back up again. And weren't the judges involved in this conversation as well?
And they had come and talked to you primarily regarding the adult court.
Right.
So,
But I thought they were involved in the decision on the
No.
delayed sentencing law. Just
I
the
think-
county attorney?
I think there was some discussion from the judges, but I know when they specifically came and spoke, it was
I
regarding.
understand that, but I was talking about
adults.
conversations that I thought Micah had told us that there had been kind of conversations with judges.
And I don't recall, I may not have been
Okay.
present at those conversations.
I'm struggling with a program that, you know, if somebody come along and said, yeah, you know, if you could chip in another 50 grand, but man, 300 grand right out of it. We're struggling to get raises to our people and we're holding together this program. That needs to be remodeled, realigned, the whole piece, but I'm struggling with supporting that with the uncertainty that we don't know if that will ever even happen.
I get it.
Okay, yeah, I know you, but it's not, I'm just speaking to the wind here. I just, man, when I went through these budgets, I thought, oh, welcome.
Yeah, this is the one I was most nervous about talking about.
Yeah, I don't blame you. Yeah, I knew it. You know, good for you. You put it right out in front of us. So you did the right thing. You get the number right out so we can see it and so anyway,
Commissioner Wilson.
Yeah, Mr. Chairman, I'm kind of in agreement with Mike on this,
Commissioner Brink.
Yeah.
Commissioner Mike, on this, and wasn't it an 80-20? Is that what remember we talked about that 80-20? And then how it's flipped on us?
Yeah.
And then didn't we also have because they aren't paying but didn't we also have a part of a pilot program with the county and with the judges or something, a pilot program in there somewhere?
I think that was adult service.
Was that adult
Yeah, mine's
services?
there.
It was a pilot program judges was working with.
So I know there's,
Fremont County.
oh, I'm not aware of one in Fremont County. I know the governor has a pilot program for mental health services in Gillette and Casper, I believe. But that's the only pilot programs for the adults that I'm aware of.
So overall, Chairman, the state funded you how much for JTC?
Overall, it was 46,651.
Chairman, we did talk about what she could do with the 4661 within programming. Right?
Yes, and I've had discussions, keep the program small, bare bones. Hire somebody part-time as the therapist. See if we can get those allocated individuals into our program, and go from there and review it again next year. I do have somebody interested in a part-time therapist position. And so that would cut down some of the costs as well, in this proposed budget. Kind of the beauty of it is I don't need a ton of budgetary items because I still have some. I also still have funding from this year because it ended pretty early in this fiscal year. So anything I do need, I think Carla said I have till the 25th to spend any money. So I can use some of those expenditures now, and stockpile up. So I think that there is room to wiggle in this to see if we can get it up and going. But it's gonna be very minimal.
So you have a case director, I mean, a director for this now? Is that part of your job?
That's me.
Right.
Okay. Geez.
And then you have the two vacant positions.
And I would not, at this point in time, want to rehire the case manager. The therapist, I would ask that that be a part-time position. And then the coordinator for the adult treatment court has already said, you know, whatever help I need in facilitating that moving forward, she would step up for what she's already doing, within the adult treatment court.
With that commitment, would that be extra to her salary?
No, not at this time.
So if,
Cause she gets paid out of, sorry, I didn't mean to cut you off.
no,
She gets paid out of the JTC and the CAS budget as
Okay.
well.
so if we left those two vacant positions, overall savings would be $191,000.
I would need one of those part-time. The therapist part-time.
So I still,
It's still a good
we
chunk of
would
savings.
say part-time position, 40,000, 50,000. I don't know.
I think it's at 62, correct?
I think so.
Yes, 62.5.
I mean, I would think for a part-time, do 35, cut it in half.
Well, so, all right. I'm just trying to figure out just what our savings would be if
Yeah.
you,
Just one.
so if you, both positions, the case manager and the therapist would be 191,000. So you would actually save about 160 some thousand dollars if you went with part-time therapy.
Mhm.
Mr. Chairman,
Yes.
it's not a savings. It's not a savings.
Right.
We're,
Can we?
it's a reduction off the $300,000 we're being asked to pony up. It's
Yeah.
not a savings,
It's
it's
not.
still an increase
But I mean,
for us to pick up a tab.
it would be less, it would be about half approximately of the current ask. How much was 300?
It's 304. 304, I think.
So
I'm looking at the budget.
it would be approximately half would be.
Or we went more than it.
Yeah.
It.
Yeah.
Struggle, plenty. It doesn't feel like we could handle a few cases, but it doesn't feel like we have the need to staff this at any level, until we figure this other thing out. That's my view. And I know we're talking about real jobs and all that, but it's just, pretty good.
Question.
Sure. Yeah, with that, if you were to go with that part-time therapist, it would be 31,241. To use that as a part-time therapist and then. Uh, 31. would have, it would be workable with what she's getting from the state in the sense of the 44,151. We wouldn't have to put anything into it. She would just use the 44,151 to pay for a part-time therapist. And then the other portion would be used, in the sense of administrative costs. And then we would just use the 44,151 in that manner. We wouldn't put anything into it. We wouldn't lose anything. Then we would see what you could do with that in the sense of running that. See what you can do with it. In a sense, we're just gonna use the state fund.
I thought the state funds were reduced to
44,151.
44,151.
Does that, however, within the state contract, because it does state that
We still have to have a match.
a 25% match?
Oh, well,
Now I could,
that's debatable because in that, when they first brought to us, it was supposed to be that match, but when we had to cover, they never said anything.
Right.
Meaning we covered more than 25%.
Lots.
Way
over.
So in this, I would wait till they say something, because then we can come back to them and say, we spent a lot of time matching more
Trying to.
for, I don't know how many years we did that, and was it covering our, in terms of not going by that.
Right,
So,
they've been throwing us under the bus for a while.
I don't know, I mean, we could look at it, I mean, but
Mr. Chairman, I would, I'd be open to just say, all right. It's such a reduced amount, even just matching them 1-to-1, to say you put in 45, we'll put in 45. And then let's see where we end up, over the years. It doesn't completely you're still gonna have to reallocate.
Correct.
We have your salary and some other pieces, but in good faith that, all right, we'll have some resources available. We still have a match. We don't throw down the gauntlet necessarily, but we just say, all right, it's 44,000. Like I said, if our match, was 50 grand, I wouldn't be sweating. I'm not at 44 and, and some change, and ours at 45 or 50, whatever it is. I think then we see where we are next year. Is that doable?
It's better than the alternative of saying, sorry, no, thank you.
Okay.
Okay.
Fair enough.
West. Good comment.
yeah, Chairman, if we were gonna do is it 20% match?
25.
25, it would be around 25,000 that we would put in.
That's.
But if we put in 44, we're doing 50% match.
You're right.
So, okay, so,
And I think in the allocation of like my wage that is in this and my coordinator's wage that is in this, because the coordinator is treatment courts, both adult and juvenile, for budget purposes, I think with the amount, that we were allocated within the adult treatment court, we could absorb some of that, and then half of my wage would go to treatment court and half would go to youth services. And that way it frees up some more of this to see what we can do and where we can go.
Well, why don't you kind of work on a plan? And with just what you were saying,
Mhm.
and send it to Julie or all of us, let us review it, because next week we're going to decide.
Okay.
And if that's workable for you and us, then we'll have a conversation.
Okay.
Chairman,
Yes.
are we gonna do it at the 50% match then? That's with Mike, at 40. If they're gonna give 44, we're gonna give 44.
That's my suggestion, but if you want to do something different, it's up to you guys. The face.
You're maybe gonna get it right.
Whatever you want to do, guys.
So,
I threw an idea.
okay. Mr. Chairman,
Yes.
the whole argument before was because we was paying more and the state wasn't paying, we were paying. So I still think we need to get back to where we were, even though it's less. I know it's harder to do, but we argued. We argued
Yeah.
because the state wasn't stepping up and paying what they should have been paying. And we had to cover it all this time. I still think it needs to go back to the 25.
I'm good with it.
I mean, that was the whole argument before.
Well,
And then, I mean, it's a little more struck, yeah.
So 25% of the 44,000.
Yeah, because it was,
Yeah.
I mean, I understand it's more than struck with it.
Well,
Till they start coughing up and start stepping up, which they should, it's ridiculous. You know, if it looks across the state here, they've only got 3. It's nuts, and we've got problems. But we shouldn't have, I shouldn't have to go back to my constituents and say, oh, well, you know, the state's not stepping up, so it's coming out of your pocket. When they get grants.
We're looking at, Chairman, we're looking at 11,038. From our side. Added to, Chairman, added to the 44,000.
Your thought.
Yeah.
Actually, my thought would be to match the state fund. And to run a bare bone, and in the meantime, in this next year, we have conversation with the county attorney's office, and we have conversations with the judges and whoever else, the Wyoming judicial branch, and see what we can do to turn this around and go from there.
What's your number? Mr. Chairman?
Well, you were thinking
Add back,
ours.
so ours would be 45,
Yeah.
go back to the 50%.
Yeah, okay.
Do I need a motion on that?
Well, I don't think we need to make a motion on
No.
it now.
We just need to make a
We-
decision next week.
We need,
So
We work with the 44.
44.
I say I can do 2, one at the 25% match and one at the 44, and then you guys can choose.
okay,
All right, that's fair.
If you have time to do that.
I'll make time.
all right.
Mr. Chairman, we're gonna put the JTC SOCs on hold, but,
I don't have any SOCs.
oh, I thought you did.
No. I'm not asking for money when I'm not.
Oh, okay, that was JTC. Okay, I thought, okay.
Well, that
My
is,
bad.
well, that is different.
Yeah,
Well, I have one in front of me,
that's the one that.
So
so that's what I'm saying,
Yeah, I have 2 for.
I had 2 for
That's
JTC.
probation.
those are youth services.
Yeah.
That's juvenile justice of Fremont County.
Oh,
Youth service.
Probation.
and it's a J versus, got it, all right, sorry about
That's okay. So I have,
that.
you know, I won't ask for more money out of that.
All right.
So I have 3 SOCs that are in conjunction with the youth services program. And it goes between youth services or juvenile justice of Fremont County. The very first one is a juvenile probation officer. She's at a current level 2, at a current rate of pay of $53,183. I'm requesting an increase of $4,703, bringing her to $57,886. As a whole, within youth services, because of the JTC numbers and the lack of funding, I have gone in to our youth services program, and we are doing a program development within that program to hopefully reach all of the juveniles that come to us in some form or fashion. Some of that is going to be a validated, evidence-based risk assessment. Within that risk assessment, it's going to help us build a case plan to identify the needs of the juveniles that are coming to our office. And to further that, I have already purchased curriculum so that when we identify those needs and we have that case plan, in moving forward, we can really work with the needs of the juveniles and within the families. So a lot of work has already gone into the forefront. All of these individuals that I'm asking for the SOC adjustments have been right there giving input, making suggestions, and helping with that. So they've already kind of stepped up in that process, in developing a better youth services. Unfortunately, also, while I was looking at the SOCs, the state of Wyoming pay adjustments came out, and I saw how low some of our individuals were that had been there within their positions for 2 years and not gotten an increase. So that is a lot of the reasoning for all 3 of these individuals. And all of the increase amounts are different, but that is a lot of the main reason for all 3 of them. That way we don't have to go through all 3 of them.
It says in your budget message that Riverton, have they made the decision on their grant?
I don't know that their budget is completely final. The night that they did their awards, they approved it for 20,000. I have not yet received that final confirmation, but that's what I am anticipating.
And Ranger didn't do it.
I have not been able to get onto the Lander City Council agenda. I have reached out multiple times. I even reached out again this morning. And so I believe it was Julie I was talking with, Julie and Jim. As of right now, Lander has not contributed what they said that they would allocate for this last budget year. So
in your revenues, they are nearly double what you got last year, correct?
correct. So
Without Lander.
yes. Primarily because I worked really hard on a grant and got a lot more money. They opened up, in previous years, the CJSB grant had a cap of what individuals could request. This year they changed that. And so there was no longer a cap. So they said, reach for the stars. And I had requested $350,000 for a biennium, and they awarded $298 for the biennium. So I felt like that was really fantastic. It almost tripled our revenue.
And that would be the federal indirect operating grant? Or
No, the CJSB grant is the Community Juvenile Services Board grant,
state grant?
the state grant.
Okay, state grant.
Yeah.
Okay. And it came in at 298?
For a biennium.
Okay.
So it was
Okay.
149
60.
for the year.
Okay, sorry.
You're okay.
All right, let's get back to the conversation about the FOC adjustments. I kind of got sidetracked. Seen something shiny. That way.
I do that quite often, so it's okay.
Okay. So we went through the salary rate at 53,183 increase. And then what else we got?
So the other individual, kind of the exact same scenario. Their current rate of pay is $49,500. Again, they've been there for over 2 years, not seen an increase, very willing to not only help internally on the functions within the program, but continues to strive and do better even in building rapport with clients, families, things of that. So his the request for him is $4,871.50, bringing it to an increased amount of $54,371.50.
Questions, commissioners? No question.
The third and last one, she is our direct services provider. So she is in the day reporting center. She is with up to 12 juveniles every single day, ensuring that they are doing their schoolwork. She provides their transportation. It is a very taxing job. She also has been very open to building upon that program. Her and I've talked about how we can make it better, what we want to do and envision in helping these juveniles, even with just life skills. And so again, she has built those community relationships through all of the school districts that these students are referred to us from, as well as the DFS offices around the county. She's been with us for right about 2 years and has not seen an increase. So her current rate of pay is $54,128, and I'm requesting an increase to $59,213 for a difference of $5,085.
Questions, commissioners?
Chairman,
Go ahead.
if there are no questions, I have motion for approval for the SOC adjustment request from based on youth services.
Second.
Been moved and seconded to approve the SOC adjustments for the youth services, excuse me, youth services employees as recommended by the director. Further discussion? Yes.
So. How did you come to these numbers? Did you go to different state? I mean. how
Not-
did you-
Not necessarily. I looked at where their current pay was, kind of what the next level of pay was, and realized that that was a huge jump for some. And within trying to be conservative of the budget, I honestly took those two numbers, divided it in half, and said, let's try there. Me and math, Miss Wilson, don't get along, so.
Well, apparently you can see it doesn't need a thing. Any further questions? All those in favor? Opposed? Motion passed.
Thank you.
Okay. Anything else for me?
Do you want me to go over everything with you services? And the budget?
Yeah,
Okay.
I thought we were done. Go ahead.
So, for youth services, the 2027 budget, with our anticipated revenues is $235,000, $456. That is an increase in revenue from $139,000. Primarily, as I said earlier, that comes from the CJSB grant that, I was awarded. Another $50,000 in revenue is from the Juvenile Justice and Delinquency Prevention program. That grant had been approved, I believe in like 2023, but then froze. And so they have allowed us now to utilize those funds. Those funds are only available until the end of September. So we're kind of scurrying and how to use those, but we do have them, so we will be utilizing them. Again, estimating $20,000 in support from the Riverton City Council. Still trying to get on with Lander. I don't know if that's gonna happen before budget or not, but still trying. A lot of the expenditures within the budget are the personnel. But also, as I talked in doing that validated risk assessment, there is going to be a training involved in that. I believe that training is $4,000 for all of the employees. So within that training, we're trained, but then they also give us cases to ensure that the risk assessment is being done correctly. We're identifying the needs, and so that it's accurate. I also have plans in transitioning to a cloud-based data management system, so that hopefully I don't go 3 months again without being able to utilize FileMaker. I had a meeting this morning and working forward on getting that in the works so that we will have that consistency within our data management. That's youth services.
Questions, commissioners? Yeah. Well, that was relatively painless, wasn't it?
Relative.
Well,
There were points.
If,
Yeah.
if the chairman could stay on task.
Mr. Chairman,
Just saying.
Mr. Chairman,
Yes.
so I have identified a weird thing on her budget in JTC, so I'll work with her on that. The 54,000 that's showing up on the 51130 doesn't match anywhere. I've already sent something to Gravity. I don't know where that came from. It looks like old material. I don't know why.
Okay.
So that is 54,000 or 52,000 higher than I can figure out. But anyway, between the two of us, I just want to let her know that I'm trying to look into that.
Okay.
I can make everything else balance, but anyway.
Well, as I said, me and Matt don't work well together, so
JTC is struggling all the way around.
yes.
Gotta take it off, count to 11.
Kevin, what I have to say as liaison is that, what wants to happen, meaning when we put a new director on, we want improvements and a sense of stability. And, State Fund has done that, so. Through a lot.
That was a lot.
Still is a lot, but we're getting there.
We appreciate your effort.
Thank you.
Thank you.
Really.
All right. Well, enjoy the rest of your day.
Yeah.
You too.
We're on the downhill slide.
I might be able to breathe the rest of the day.
Oh,
So thank
perfect. Perfect.
you.
Jim, you want to start with investment pool? We're a little early.
Wherever you want to start.
Let's start with that.
I know.
Yeah.
I did that too
Right.
that random 5.
earlier.
Yeah.
A lot of stuff, some this. Like,
I've noticed those are in there.
Yeah.
this helps, but
After Jim, we'll do the ambulance.
So we don't have one thing.
Pardon
I thought we had oh, you were gonna do the ambulance before the wellness?
I have some evidence stuff. I have a handful of the. If you have budget messages on any of these, they're probably from last year. So
Okay.
take them with a grain of salt. They'll be updated.
So you'll do the ambulance fund or?
I have done a swag of the ambulance fund. I feel like that one is more of a work session type.
Mr. Chairman, while we were at lunch, Larry and I got a notice from Frontier. It says, when we had met with them earlier, they had indicated that whatever increases the bargaining unit would asked for, they just absorbed, and now they're saying it's way high, that they come in and they're just sitting down with collective bargaining, and they are asking for the moon, and it could, if it stood where it is right now, it could be $1 million hit.
Oh, jeez. Wow.
So I think we need to give a little more time.
Yeah.
With those guys to see where we're gonna roll out, because
That's nuts.
it's,
Do we want to dive into ambulance? I mean, I can show you what I did
Well,
and
I think they just threw a wrench at us.
Yeah.
Sure.
I glanced at your budget in there, Jim, and then,
okay.
That's
Yeah.
obnoxious.
Yeah, I mean, I was going off of the proposal of a 1% increase.
Right.
That's what I sent yesterday.
Right.
Yeah,
Right.
and then the balance of the dispatch fees as well.
I think we're a little bit on hold with them.
Okay.
If we can,
Good enough.
and just my views.
I agree,
Okay.
and I'm gonna make some phone calls when I get out of here, if I can get hold of anybody.
Yeah.
You don't want me to make them.
See if I'm- Okay. Go ahead,
Alright,
Jim.
So we can skip the ambulance,
Wow.
Yeah.
unless you want to talk about the EMS stabilization things, which ends it on June 30th, so. There's not much to talk about for next year unless they extend it through December. We have not spent very much. I think we're gonna leave about $800,000 on the table, and that's assuming that we're gonna see some additional invoices from Frontier coming through on that. We're at $83,000 for the current year. So I anticipated 100,000 just as a shot in the dark, so I don't know. But like I say, the current agreement has that ending on June 30th. It's ARPA money, if I remember correctly, which means it needs to be spent by December, but so I don't know, the Department of Health, if they would be willing to extend it for 6 months to try to milk it a little bit more, but and at least it's not money that we have to pay back. It's
Right.
on the state, so.
Okay.
So that's that.
Where do you wanna start? Investment pool?
I can do,
What do you got pulled up?
I have a bunch of them pulled up. I could do let's start with the health benefit plan. That's kind of the big one.
Okay.
I'll get you guys while you're fresh.
Okay.
All right, so this morning, we talked about rates and we have that approved, so. The health benefit plan, of course, is our health insurance. We are a self-insured or partially self-insured plan, which means that it's our plan. We decide what we cover. We decide who our vendors are that work with us. The reason why I say it's partially self-funded is because we do have a stop loss provider, which for very catastrophic claims that will step in and cover the big claims. We get reimbursed for anything that is a large amount. It's a little complex to talk about the funding of that, but I'm happy to if you want to understand it better. But so for revenues coming in to the health plan, of course, we have our insurance contributions, which is the premiums that are paid by the employees and the employers. The county, the main county is the primary client on here. We do have Wheaton Pest, which I guess is the only external entity that is still on our health plan. We historically have had the solid waste district, we had the fire district. They have all over the years gone different ways, thought they could find a better deal, and I hear sometimes they wish they had not, yeah. So anyway, so as I say, revenues coming in, we've got premiums, of course, just investment interest that is paid out through our investment pool based off of the cash balance of the account. And we have insurance reimbursements, which is that stop loss reimbursement that I was mentioning. We also get prescription drug rebates that come through and are paid on a quarterly basis. So for the current year, we had budgeted for revenues $6,670,000. I am projecting $6,204,000. And that's okay that it's a little bit lower because most of our rates are based off of a per employee per month basis. We always budget for typically 235 employees or participants on our plan. We have been averaging lately closer to between 220 and 225. So it is normal that our premiums are going to be somewhat less. The bigger one that is a little bit lower, and you can take it for what it's worth, our stop loss is not projected to reimburse us very much, which means that we haven't had a lot of big catastrophic claims. So that's a good thing. But that also looks like, past years, for example, fiscal year 24, we had $626,000 in stop loss reimbursements. And I'm only anticipating 115,000 for the current year. Looking ahead to next year, revenues are budgeted at $6,917,000. The bulk of that, 6,000 or 6,102,000 is premiums coming into the account. And the other, I shouldn't say the other big one, but we're anticipating $450,000 in prescription drug rebates. The anticipated stop loss reimbursement, which is just a percentage of claims, is our best guess, $232,000, and then investment interest of $133,000. All right, on the expenditure side, so on the expenditure side is where we pay medical claims. That's by far the largest line item that we have. We had anticipated or budgeted for $5,600,000 in claims. We're actually projected to be a little bit over that, $5,660,000. And that's, again, we just base that off of a projected per employee usage. It's interesting that you would see that the claims are larger, but our stop loss is lower. What that indicates to me, without digging way deep into the weeds, is that we've had a lot of big claims, but not big claims. And so, if it doesn't tip the scales to hit the stop loss, we just have to cover those claims. So that's the big line item there. Projecting ahead to next year, I'm anticipating $5,800,000 in medical claims. We have administration fees. So we use Blue Cross Blue Shield as our third-party administrator. We've used them for a lot of years. They've been great to work with and provide us really some pretty good discounts on things. So they generally increase their fees by about 6% a year. So anticipating, we budgeted $185,000 in the current year. I'm expecting that to come in at $181,000 in the current year. Next year, $196,000. Contractual services, we utilize a benefits consultant to just kind of make sure that we're following the laws and keeping us on the straight and narrow. They also provide actuarial services that we need to do for some audit related things. And we also have another vendor called Work Partners or Nova Solutions, depending on which piece of paper you're looking at. They do some case management stuff. So they step in when there are individuals with very large claims, and they just help those individuals through the processes. We have MASA ambulance coverage that's paid through the health plan. We're anticipating $62,000 for that. That's what we budgeted last year. We're anticipating $55,000. I budgeted again $62,000. Again, that's all based off of the actual number of employees that we have in the county. We used to have vision used to be rolled into our plan. We've separated that out, decided to go with VSP as a provider. Generally, they just offered a more robust plan than what we could get through Blue Cross and Blue Shield. So I think that's been a positive thing for us, but it is a relatively new expense as well for us. So we're looking at $50,000. So in that case, we're paying premiums and then they cover all of the benefits, their benefit payments. So we don't see the individual claims coming through our plan any longer. We have a transplant rider that we added years ago. So this is one, if we have anybody on our plan that goes for organ transplant, these guys step in and cover it 100%. So those, we don't see any expenditures come through our claims on organ transplants. If they did joint transplants, but I guess not. So, our stop loss carrier is Voya. Again, this is on a per employee basis. In the current year, we anticipated $750,000 in premiums for stop loss, anticipating that to come in at $693,000 for the current year. Stop loss industry-wide goes up a lot every year. We've been pretty fortunate. We've been with Voya for quite a while, and they, for the industry have helped really keep our costs under control. But nonetheless, we're looking at an $847,000 budget for stop loss premiums in the upcoming year. Those typically rise from between like 13 and 16% a year. So gets to be a lot. And then we have one line on item miscellaneous services and charges. This is another vendor we work with called Cotivity. What they do is come along on the back end and audit claims and see if there's any sort of cost savings that just anomalies with the billing or whatever. If they find cost savings, then they get a portion of those savings. That's how they get paid. So we don't pay them directly, but they get some of our savings. So they get 26%. So for every $100 in claim savings, they keep $26 and we get the other $74 credited back to our account. And it works the other way around. If they audit the claim and find out the claim was billed too low and there's a correction made from there, then they lose the money as well. So that's the health plan. It's a big plan. Our budget for next year on the expenditure side, $7,115,000. But overall, we're in good financial position with our health plan. We've got good savings in the bank with the health plan, which is why we're able to do 1% increases on our health insurance rates.
Questions?
You said 1%.
We did 1% on our health insurance premiums, yes. One of the things that we did discuss, and I guess, within our committee, we discussed about, when we have employees that waive coverage off of the health plan, so they've got health plan through a spouse or, some other thing. The problem that we've had in the past is if an employee that has waived coverage leaves and then we hire a new employee and that employee now wants to be on the health insurance, that creates budgetary problems for the department because we didn't anticipate the employer side of that. One of the things we had talked about is doing the employer portion of the premiums based off of a department head count as opposed to the actual people that we have. So, for example, in the treasurer's department, we have 11 employees, so we would be paying 11 health insurance premiums, even though I might have an employee that is not actually on our health insurance. So what that does is it moves more money into the plan as contingencies, but then also means that we don't have to go back and circle back and do department budget hearings and things like that in mid-year because of an employee change that happened. So something to consider. We're not going to do that without the commission's blessing, but we'll save that decision for another day. All right. Anything else on health plan?
Anything on the health plan? Health benefit plan? Okay,
I guess one other thing, I'm assuming that you'll be meeting with Tatum at some point. That's our
Today.
health promotion
Today.
is, did you today?
yeah, she's on.
Oh, she's on
agenda.
later? Okay.
Yep.
Good enough. No, I didn't do her budget. But that is also part of the health plan is the health promotion part of it. Is on a separate department. Okay. How about investment pool? Another fun one. So the investment pool is sort of handles the business side of our treasury and our investments. So it's in this fund that we record all of the interest revenue that we receive on our combined treasury investments. We also record any sort of fair value changes and if we have any gain or loss on investments as they mature or we buy or sell them. So that kind of constitutes the revenue of this fund. For the current year, we had anticipated $2 million in investment revenue coming in. Our actual performance is good. Of course, we've been anticipating interest rates to start to go down now for a couple of years, and for various reasons, they haven't gone down as much as what we had anticipated. So in the current year, anticipating $2,424,500 in interest revenue. Looking ahead to next year, we're anticipating $2,250,000 in interest revenue. Again, trying to be conservative, assuming that interest rates will probably go down at some point. On the expenditure side of things, we have our bank charges. So this covers, not only bank fees that we get through our bank BMO, but any sort of other fees that we have associated with, like we use an investment manager, for example. So we pay a monthly fee for them. It's based off of the amount of money that we have invested in or through them. We're charged a fee for that. So it's a fairly substantial fee when you add it all together. We anticipated $60,000 for the current year. We're only looking to spend about $43,000 in fees, so that's a good thing. So looking ahead to next year, anticipating $50,000 in bank fees. Depreciation, given that this is an internal service fund, the investment pool owns one asset, which is our check scanner, which was a whopping $1,000 when we got it. That is nearly depreciated out. So we'll have $100 worth of depreciation in the current year, $25 in the next year. So and that will go away until we need a new check scanner. Also in this, from an expenditure standpoint, this is how we also divvy up interest and pay it out to both our internal funds. So we do an interest allocation on a monthly basis based off of the cash balance of all of our funds. And we also pay interest to external entities. So every tax distribution I do, we have to calculate how much interest that money that we've held for up to 30 days has earned, and we have to pay that out to all of our external entities. We also, as a county, hold money for just a couple and sort of act as our bank, as a bank for a couple grazing districts. The Historical Preservation Commission has a little bit of money on account with us, and so we do pay interest to them on a monthly basis as well. So in the current year, interest allocations, we budgeted $1.5 million, anticipating the payout being $950,000 for the internal interest. So that's just money moving among county funds. For the external interest paying out to other entities, we anticipated $400,000 in budget. look like we will do $219,000 for the current year. And so we're budgeting again next year, 1.5 million for internal interest and $400,000 for external entities. The way that interest is allocated is we, Brian and I in particular, set our interest rate that we pay out. And it's, based off of the performance of our investments. So as our investments do better, we pay better interest. So that's the investment pool.
Question?
Yeah, that's true. What banks, do we go through long council?
What banks do we use?
Yeah, do you use local bank?
Well, so we do for our local banks, we use BMO, the Bank of Montreal. And so they're the ones that handle our checking accounts, our warrant account, things like that. Wyoming Class is an investment pool. And so, we move money off to them and they pool our money with other governmental entities and buy very short-term investments. So that is very much like a money market fund, is sort of how that behaves. That is, can't remember the name off the top of my head that administers Wyoming Class, but it is a nationwide firm and they administer these investment pools for states across the United States.
Okay, so little bank, no community bank gonna be able to handle that, right?
No, I mean, we do have a couple small investments. I don't know if I would really call them investments. We do have a bond that we have with the local BMO bank that is used in, or it's a CD, excuse me, that is in lieu of a bond for, I believe, some underground storage fuel tanks that are up at Du Bois. I don't know if they're like where they are, but it's a bond that or in lieu of a bond that the EU would require because of these storage tanks, we buy this CD instead. We also have essentially it's a very small money market account with another local bank.
Why I bring it up is some of the people at those smaller banks that Fremont County asked me if we could do more business with them. That's why I bring it up. And that's what you're talking about. It's pretty big. Has to be a pretty big pool.
Yes, yeah. I mean, if we were to look at, and I'm not at all opposed to considering, purchasing CDs or something like that through local banks. I think to wholesale move all of our banking to another bank. I mean, I mentioned earlier that we are going to be moving because our branch is sold. We're going to be moving to new banks. We do have a few requirements that are our internal requirements, and that is that they need to have branches in both Lander and Riverton, because we've got people that are in Riverton making deposits and people in Lander making deposits. So they need to be have a presence in both Lander and Riverton. Of course, need to be able to have the collateral to back our balances. Because our bank balances are higher than the FDIC. So, so they have to work with other banks to have.
So it would be best for those banks to contact you.
If somebody has a proposal they would like to present, we do a lot of online stuff. So that's a big criteria for me too, is what their online banking looks like as far as daily statements, and being able to do ACHs and wires and all of that stuff.
I'll contact you, Jim.
Yeah. Yep, that's fine.
Thank you, Mr. Chairman.
Anything further on investment pool? Okay.
All right. The one that I don't think was on the list, but I have done is the detention facility trust.
Okay.
And that one's fairly straightforward. if you don't have paper on it, I can hopefully explain it to you. So the detention facility trust was created when we built the new jail. It was additional sales tax that was collected beyond the purchase or beyond the construction cost of the jail. It's set up as a permanent trust, which means there's a corpus that we can't spend, but we can use the interest that is off of that corpus to provide ongoing maintenance and improvements to the building. The corpus, let me see, I can tell you what that is. It's $2.7 million. I can tell you exactly. $2,759,015.15 is the amount that we're unable to spend. But the interest that is gained off of that is available to spend. And so I worked with Jay from the building department, since he's got very intimate knowledge of what happens over at the detention center. And so the only revenue that comes into this is the interest that's earned on it. We're anticipating $72,000 in interest in the upcoming year. What we're missing ultimately is we need to have a 5-year plan put together. That's kind of been lost as we've had turnover with the different people. I had some assurances that there is nothing that is imminently failing at the jail at the moment. However, there are some, I think, 5 more rooftop units that are probably nearing their end of life, and so that's, we kind of are anticipating over the next 5 to 10 years that we'll have to replace those, and then probably start all over again. I don't recall how many rooftop HVAC units they have up there, but it is like 30 of them. A lot of it. Yes. So anyway, we just basically put some money out there to kind of handle contingencies. So our budget for the current year on equipment less than $1,000, we've budgeted $5,000. On building improvements under $10,000, we budgeted another $5,000. Building improvements over $10,000, we budgeted $20,000. For machinery and equipment greater than $1,000, we put $40,000 in it. And then traditionally, we have done a $25,000 transfer out of the fund into the general fund, into the jail department to offset the cost of utilities. So pretty straightforward. The interesting thing about this, and Brian, my deputy, and I are working with this, that right now that $2.7 million that is the corpus of the endowment is just rolled in with all of our investments. Given that is totally not spendable, it would probably work better for the trust if we were to segregate that out and do very specific investments with that one that are longer term investments that would potentially give us a little bit more earnings over the year, as opposed to just being paid out through our investment pool. So we're sort of laying the groundwork to see how that's working, or how that might work. We're working with one of our investment brokers to see how we could do that, and sort of set that up as its own set of investments. It probably wouldn't be a single investment for $2.7 million. We'd probably space that out, kind of ladder it out, so that we've got investments that are maturing at every three to 5 years or something like that. So that may change a little bit, mostly on the revenue side, of course, is how much money that comes in, but stay tuned.
Mr. Chairman.
Okay, yeah.
So the corpus is 2.7,
Yes.
and what is the balance of the funds that could be spent? I said $72,000 for this year. That's not all of it.
No. So our current cash that's in the fund, which includes the corpus and plus any accrued cash minus, what we spent, which we actually haven't spent anything in the current year. Yet we'll do the $25,000 transfer into the general fund. So that's all I have anticipated in the current year for expenditures. So our cash balance in the fund is $3,193,000.
So about 400,000.
Yes,
See how fast I got to that,
450. Yep.
as opposed to you.
Okay.
Why do you make the big bucks?
Question,
Senator.
any further questions on detention trust? Okay,
Mr. Chairman, just for reference. We did spend some of those funds on the jail doors.
Yes,
And replacing those. We did get a slip grant. But we did spend, I can't remember what we did, but we did
Yeah, it
pull
was-
some of those funds.
probably a couple $100,000.
5 years ago,
Yeah, more than 5 years ago.
which was a huge project. It was $1 million fund.
Yes.
Okay.
And that's the kind of stuff that's, that's gonna have to happen again. I mean, not imminently, but you just know that, the technology is gonna change. They had to rip walls open and it went from like a chain driven door to, like a rack and pinion. So, that all of the controls and everything like that is all buried into the
Control
wall.
system.
Yeah. Abandoned vehicle?
Okay.
You got that one? This is the last one I have, since we already talked about it.
Okay.
So abandoned vehicle fund is, for every title that's made in the clerk's office, part of those fees go into this abandoned vehicle fund. It is used for the county to be able to, pick up vehicles that are alongside of the road that have been abandoned. So we pay towing bills out of this. And then if there are vehicles that ultimately are sold, and when I say sold, they generally go to the car crusher. That's, so we get the sales revenue from the crusher for whatever basically the scrap metal fee. So I want to say that in recent years, it's about $340 a car is what we get in that. So the most consistent revenue coming in, of course, the abandoned vehicle tax, which is built into your title fees that you pay when you purchase a new vehicle or do anything with your vehicle titles. So we are anticipating about $16,500 in title fees coming in the current year. We budgeted 15,000 in the next year, which has been kind of consistent across the last several years. So then again, abandoned vehicle sales would be another potential revenue. This is just kind of a placeholder. There's no really good way of knowing what that's going to be. So $5,000 potentially for abandoned vehicle sales. On the expenditure side, we have towing bills that would be paid out to the local tow companies. I believe that is set by statute as far as how much we pay for those. I would have to look that up to be sure. So again, just $5,000 anticipated for towing. And then typically it's in order for that fund, it doesn't need to grow indefinitely. So we siphon off money on an annual basis and just move money over to the general fund to be used for general purposes. We budgeted $25,000 for the current year. So we'll make that transfer in this month as well. And next year budgeted $20,000. The interesting thing about this one is we've had no activity as far as vehicle sales or towing bills this year. My guess is that the sheriff's office has been paying the bills and then showing the money as revenue into their department, which is probably about a wash. From my side of things, just looking at it through our accounting software, I can't honestly tell what would be a abandoned vehicle towing versus anything else that they might be paying towing companies for. So that's one that I think ultimately wanna get back in communication with the sheriff's office and make sure we're all on the same page and doing the same thing, so.
Question.
Yeah, Mr. Chair.
Yeah.
What, if a vehicle's left at a vendor, is that vehicle then that individual, that vendors, or is that counties?
Are you talking about like on private property or?
Yeah, be on private property, let's just take like Bayless, for example. If you had an abandoned vehicle there, somebody said, yeah, no, we're fixing, leave, walks away from it. Who's this? Is it the counties or?
No, it would be, so if it was like a left at a mechanic or something
Yeah,
like that. You know, there would be, you know, basically a mechanic's lien that's put on it. And through that process, they can go through the sheriff's office and get the title for the vehicle. And so there's a process they have to, you know, advertise and, you know, make sure like whoever owns the vehicle has an opportunity to come retrieve it, or, you know, and then pay the storage lien or the mechanic's lien or something like that.
Sure.
If it's private property, you've got a field and there's a vehicle that is just out in the middle of the field. A little bit of the same process, then you would get through what they call a sheriff's certificate of compliance, I think is the official title.
So the funds that you would receive is somebody leaves it on the county road, right?
Yes, yeah, this would be
They
things that,
don't on the county road,
yeah.
okay,
Okay,
thank you, Mr. Chair.
okay. That's all you had, huh, Jim?
I think so.
Okay,
I didn't do anything with capital revolving since we haven't met yet. I can, I was talking to Julie, I could certainly put a budget together. I did do one for the forest reserve, which we could talk about or not.
rural schools.
Yes, rural schools. That one's a little convoluted.
Yeah.
So we can save that for another day. It just like a lot of these, it includes some guesstimates of things that I don't really have any way to predict how much more money we might spend before the end of the year. But anyway, and that, you know, if you remember on the Title III side of things, the money that we received in the current year, so we received 2 years worth of Title III money. We are not allowed to spend any of that until we go through a 45-day advertisement period. We advertised in the middle of May, so everything should line up nice. We'll have a public hearing on the Title III money for Forest Reserve on June 30th. When we adopt our county-wide budget. That's in the wings. One of the things that I will say about that one, one of the approved expenditures for Title III money it includes equipment purchases and replacement for 911 systems. So that's actually something that we have advertised this go around, is setting aside some amount of money that could be available for dispatch to replace equipment. So what we advertised was $71,973 for equipment replacement for the dispatch fund. And so if that's how they want to do it, that's what we'll do.
Sounds good. Any further questions for Jim? All right, well, thank you, Jim.
Thank you.
Appreciate it. Katie?
What me?
That court's mine. Once you leave it, then.
I can.
Okay.
I'm happy to.
Okay. All right, good afternoon. For the wellness program, it has been a good year. There was a good turnout for the health fair. There continues to be a lot of participation with the other parts of the wellness programs. And everyone's really involved. And with that, my budget essentially stayed the same as it did last year. There was just a slight increase in the dues and subscriptions part of it due to the cost of the wellness website had gone up, and that was essentially everything there. Otherwise, everything's basically the same.
Questions for Dave?
Okay, and then the safety part of it. I was able to obtain a 3% discount on the workman's comp. And that came to approximately $800 a month that it saved. So for the period of February through April, the discount total was about $4,000. And that's in place for 3 years, and then we can just keep reapplying. There is a possibility to increase that discount amount. I would like to look into that. There's a various things that have to be addressed and shuffled around and things like that.
I think we'd like to see the report from the workers' comp folks, you know, when the gal came in here, did an investigation or whatever.
Did the walkthrough.
Right.
And because of that, we qualified for that discount. So the report is, I can get you that, it's quite lengthy. It is one per department or floor section or office or whatever that we went into, if there were anything there. And so I can get those to you. And that, so our discount percentage is based off of our EMR number, the claims amount. It's, each department has a different one, and then there's an accumulative one. So that's how we go about, there's a couple other ways of looking into it deeper to get more of a discount as possibility. But otherwise, my budget stayed the same with that as well.
Questions?
Would you like those, that report? Do you want me to give you the stack of it, or there's quite a lot?
Can you give us an executive summary of it one day after budget season?
Yes, I can do that.
Yeah.
Okay.
I'm about
Yeah,
rain Friday today.
a lot of people.
And Mr. Chairman,
Yeah.
are you gonna go around to like each of the departments, cause like things disappeared after she was, or whoever it was that was here? I kind of like to know why, so if you know what those are, it would be really nice to go to each department and say, this is what we found in your area, and that's why we took it.
Yeah, so what you're referring to, that was, there was a couple of things such as extension cords that were, the wires were exposed in them. That was the biggest thing, that they call it a hazard. And then they want it to be, you can, what they call it is abated on site, which means they just take it and get rid of it because it's a hazardous thing.
Yeah, well, if we could do that,
Yeah.
an executive summary and
Okay.
maybe make a graph what needs fixed, how the cost share or discounts would work. And go from there.
Sure, I can do that.
Okay, any other questions?
Mr. Chair,
Yeah.
I guess we have seen a pretty good deduction in our health insurance because of the program you're running.
So there's no way to give an exact number just because of HIPAA and all those kinds of things, and you can't. But overall, with the participation, it's kind of, you can't really give an exact, but there is a lot of participation. And just from the feedback I get, there is positive and there's a lot of participation with the health fair, 'cause people are interested in their blood work, they want to know their results, they want to get better. They want to feel better, so that's kind of,
Cause I thought that's what we said earlier. I just make double checking here, that we did see some pretty good,
So it's,
uh,
it's,
savings from.
it's easier to get a TPA, provider if we provide a wellness program. And a lot of counties are looking at our wellness program and trying to copy it like we do because they get a bigger discount on their TPA provider and I don't know what else, Jim, but that's the main thing. So,
I just wanted to make sure I heard it right.
yeah,
Thank you, Mr. Chair. Thank you.
well, thank you for coming in.
thank you.
We'll talk to you soon. Want to do commissioners now, or you want to take 5 minute break?
Oh. Is this the last one?
Yes, yeah,
Why don't we just get her done?
let's do that.
We'll get her done in 2.5 minutes.
Okay. You're on,
Goodness.
you're,
It's taking time to do.
Not a lot of significant changes from last year. We did increase the wages. I'm sure you remember just because you got a lot of hand mail about that.
Oh, totally.
less sport.
Right.
So, there's some inflationary expenses that are baked into this. Overall, it, I don't know, a $25,000 difference in the whole piece. The WCCA dues were pretty flat. The Waco charges went up, so I only budgeted for 2 people going to Waco. Just again, a lot of not significant things. I mean, you can glance down through the numbers. I did increase the travel expense, just from an inflationary, piece, so. That's it. No big surprises in there. It was pretty much the same.
Questions?
7 or 2.5 minutes.
Who next? 20 minutes, yeah.
I got one.
Oh, gosh. Yeah,
I
Yeah.
left too.
yeah.
So on our postage, since everybody's talking about going up, do we use much postage at all? Do we,
I
do
did
quite a
not.
bit? Because that's all going
Yeah,
up. It's
because that
jumped
kind of
twice.
came after I did this, which was.
It jumped up twice, or it's
Do I
gonna
need
jump
to
again.
add a little into that? I don't know.
I know we're putting stuff into your Google Drive and leaving your packets here, so some of that used to be huge is gone down. I know Board of Equalization, you send it out under them. Board of Equalization, I think what she does, the health letters that we send out to people. So
Well, it just went up and it's going up again, so that's.
we can take a look at that.
Yeah, let's take a look at it.
And
Yeah,
double
good
check
question.
it.
Anything further? Okay.
Mr. Chairman.
Yeah.
I don't want to forget, so I want to put it of record, the Helper Health Hospice. We've not had them come over and do a budget hearing because really they just ask for what they want out of their endowment. And so I know Jim's gonna work out whatever he does on their stuff, but they are asking for 190,000 from their hospice facility trust fund for the current fiscal year. I just wanted that to be in the record that we have received their request and we'll put it in the budget.
Any idea what the balance is on that?
I think that's the part Jim was gonna look up later to see like where they are. Do we have that or just, do we hold it?
Yes.
Yes.
Yes, so they have, just over $1 million, about, 1,055,000 available in their trust, and unlike the detention facility trust, this is not a permanent trust, it was in the last 40 years, I think, so as long as they can use it as
As they see fit. Okay. Anything further?
Mr. Chairman,
Yes.
not on the budget part, it was on else, another subject I would like to talk about.
Okay.
Um, the, property that we have over in Riverton,
You'll have to talk into the microphone.
property that we have in Riverton that is, a house that sits across the street from the fairgrounds property, has kind of been under the wing of their board. Seems to be giving them heartburn, so they've had, in the budget, I guess they've had their water and sewer disconnected. I think we need to take that property so they don't have to deal with it. They really don't want to deal with it. And put it in with that other property that we have got across the street, the two buildings. And put it out there for some of our departments, if anybody can use that building, because I know there is. They really want it. And use that building, because it's just sitting there and sitting, that's not good. But I do know people that do want that building and can really, really benefit from it. So, I would like to ask this board to consider that. We just take control of that, because I think the only thing they're paying right now is maybe some insurance through their pool of all their buildings. So, I think we can put that to better use. Put it out to the different departments, but I already know one that's really begging. For that.
Your thoughts, commissioners.
I can tell you who wants it,
Commissioner Thomas.
It's county property anyway,
right?
so how could we take over something we
Well, I mean,
already have property of?
well, just take it, because they're paying the insurance, and so they don't have to pay that insurance, put it over to our other, however we do that. Magic. So they don't have to pay that out of their pool, their, whatever insurance they're paying. That would be the only thing I think that they have to.
Well, they have utilities and that kind of thing, but I guess, I think that maybe we can consider it, but, we did tell the fair board that we wouldn't do anything until after the
Well, we
fair.
can do it after the fair, but I just think we need to.
But I think if there's interest in it, we can, kind of go discreetly about, not discreetly, but just see if there's a need, or if any other department has a need, that we may do something. I don't know. Your thoughts?
Chairman, it's, fair board already knows it's county property, it's just the fact that it's been there so long and nothing's been done. It's just, it's our responsibility to do something with it, and so.
You want us to do something, to us, put out a broadcast to all the departments or something that
Yeah, if any of the departments feel like it's a need,
they.
what is the need? And to report to us, or they can feel.
Have any, Trevor, do we have any attorneys that, rent their office space that we're use that?
No.
No, we have that contract with the state that we pay monthly rental fee. But they have, it's really already established.
Yeah,
So,
but they, that goes through the state though, right?
right,
Okay.
Mr. Jones,
Yes, sir.
what's your thought?
When's the power turn off?
You got another 45 minutes, right?
No thoughts on stuff.
Okay, I'll give you a thought in a little bit.
We'll give it some thought, and then,
We discussed.
discuss it later on.
We can send it out if you wanna send it out.
Do you want us to send it out to the,
No.
details or wait?
I think we ought to wait until after the fair
Well, it's
because,
in August.
Oh.
Yeah.
Okay.
I mean, we did tell the fair board we weren't gonna
Wait.
do anything until after the fair and then we would have a discussion.
I just weren't concerned about that building study as well, but after the fair is fine.
Chairman, I'd be more concerned about the annex too.
Yeah.
So
Same.
after the repair, when there has to be some decision on the annex.
Right.
Because we have to really understand the fact that is it going to make money? If it's not going to make money, then what do we do with it?
It's not gonna make money. Then we need to have a plan to get to it.
Mr. Chairman?
Yes.
I'd like to delay that until 2027.
Thank you so much.
No. No, August. You get to get here.
Yes.
Now,
Okay, thank you.
Thank you.
I'll follow up with the appointed and reappointed board members. I have Larry down, replying to the email, the priority email today. I'll contact Justin with TCI to see if he can come in person for an update.
Mr. Chairman?
Yes.
One thing that Commissioner Jones was gonna work on, and then I brought forward a couple of MOUs, but I thought we wanted to help each one of our boards a little bit better with the expectations of what they are supposed to do through an MOU starting in July 1st. And I'd be happy to pull out the MOUs from another county and start thinking about what we want to put in those, just so that that's a good communication tool to send to send to them on that. And in addition to that, I have already started reaching out to them on their advertising. When we had a budget hearing with the fair, I did address that the advertisement that needs to go at least out to all of the news media, and that they used to advertise in the paper, and I don't know that they have to advertise, but they do need to send it out so they have access to it. Facebook is not a public notice for the world because not everybody has Facebook, and that's why we're still doing newspapers, is because that is the kind of the legal part of it. So I've already started doing that, which could work into this MOU to make sure that they're following those procedures. I'm going to send it to the museum and the library as well, and a recap in writing to the fair so that they have that from me. So I think we've gone over that, maybe not as heavily as we should have in the training that I give them all. So I think I will send that out separately. I did get some information from our civil attorney that will help me with that. So that will go out. I'm gonna try to get that out this week because I did bring it up during a budget meeting, so.
Anything further? Commissioners,
Move to adjourn.
Second.
those in favor?
Aye.
Aye. We're adjourned.